Welcome to NCLEX over NCLEX, another video about fundamentals of nursing practice questions. Pause the video for more time while reading the questions and rationales. Question number 1. A male client has a nursing diagnosis of spiritual distress. What intervention is best for the nurse to implement when caring for this client? A. Use distraction techniques during times of spiritual stress and crisis. B. Reassure the client that his faith will be regained with time and support. C. Consult with the staff chaplain and ask that the chaplain visit with the client. D. Use reflective listening techniques when the client expresses spiritual doubts. Answer: D. Rationale. The most beneficial nursing intervention is to use non-judgmental reflective listening techniques to allow the client to feel comfortable expressing his concerns. D. A and B are not therapeutic. The client should be consulted before implementing. C. Question number 2. The nurse is providing passive range of motion (ROM) exercises to the hip and knee for a client who is unconscious. After supporting the client's knee with one hand, what action should the nurse take next? A. Raise the bed to a comfortable working level. B. Bend the client's knee. C. Move the knee toward the chest as far as it will go. D. Cradle the client's heel. Answer: D. Rationale. Passive ROM exercise for the hip and knee is provided by supporting the joints of the knee and ankle, D, and gently moving the limb in a slow, smooth, firm but gentle manner. A. Should be done before the exercises are begun to prevent injury to the nurse and client. B. Is carried out after both joints are supported. After the knee is bent, then the knee is moved toward the chest to the point of resistance. C. 2 or 3 times. Question number 3. What client statement indicates to the nurse that the client requires assistance with bathing? A. I wasn't able to pack a bag before I left for the hospital. B. I don't understand why I'm so weak and tired. C. I only bathe every other day. D. I left my eyeglasses at home. Answer: B. Rationale. Bathing often makes a client feel weak, and if a client is already feeling weak, B. Assistance is required during the bathing process to ensure the client's safety. A and C do not pose safety issues. Although D may pose a safety issue, further assessment is needed to determine if this in fact poses a safety issue for the client. Question number 4. How should the nurse handle linens that are soiled with incontinent feces? A. Put the soiled linens in an isolation bag, then place it in the dirty linen hamper. B. Place an isolation hamper in the client's room and discard the linens in it. C. Place the soiled linens in a pillowcase and deposit them in the dirty linen hamper. D. Ask the housekeeping staff to pick up the soiled linen from the dirty utility room. Answer: C. Rationale. The nurse should be careful to keep the soiled linens from contaminating the fresh linens, and should handle the soiled linens like any other dirty linen. C. A, B, and D are not indicated. Question 5. A client is admitted with a stage 4 pressure ulcer that has a black, hardened surface and a light pink wound bed with a malodorous green drainage. Which dressing is best for the nurse to use first? A. Hydrogel. B. Exudate absorber. C. Wet to moist dressing. D. Transparent adhesive film. Answer: C. Rationale. To provide moisture and loosen the necrotic tissue, the eschar should be covered first with wet to moist dressings, C, which are discontinued, and then a hydrogel alginate can be placed in the prepared wound bed to prevent further damage of granulating any surrounding tissue. Although a hydrogel, A, liquefies necrotic tissue of slough and rehydrates the wound bed, it does not address wicking the purulent drainage from the wound. Exudate absorbers, B, provide a moist wound surface, absorb exudate, and support debridement, but do not prepare the wound bed for proper healing. Transparent dressings, D, are used to protect against contamination and friction while maintaining a clean, moist surface. A male client arrives at the outpatient surgery center for a scheduled needle aspiration of the knee. He tells the nurse that he has already given verbal consent for the procedure to the healthcare provider. What action should the nurse implement? A. Witness the client's signature on the consent form. B. Verify the client's consent with the healthcare provider. C. Notify the healthcare provider that the client is ready for the procedure. D. Document that the client has given consent for the needle aspiration. Answer: A. Rationale. Written informed consent is required prior to any invasive procedure. The healthcare provider must explain the procedure to the client, but the nurse can witness the client's signature on a consent form. A. B. Is not necessary since written consent must be obtained. C. Is not correct because written consent has not been obtained. D. Must occur after written consent is obtained. Down to the last question, a client is admitted to the hospital with intractable pain. What instruction should the nurse provide the unlicensed assistive personnel, UAP, who is preparing to assist this client with a bed bath? A. Take measures to promote as much comfort as possible. B. Report any signs of drug addiction to the nurse immediately. C. Wait until the client's pain is gone before assisting with personal care. D. This client's pain will be difficult to manage, since the cause is unknown. Answer: A. Rationale. Intractable pain is highly resistant to pain relief measures, so it is important to promote comfort, A. During all activities. A client with intractable pain may develop drug tolerance and dependence, but B. Is inappropriate for a UAP. Since intractable pain is resistant to relief measures, C. May not be possible. Psychogenic pain, D. Is a painful sensation that is perceived but has no known cause. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to like, comment and subscribe future nurses.